Yep. Hey folks, Kevin Jefferson, the DC Foot Doctor here for another Q&A live stream. Thank you for joining me. I'll give everybody a few seconds to join on in, and we'll see how things are going. I hope everybody's doing well in these trying times, these uncertain times. Stay home if you're supposed to stay home. Be safe and look out for your friends and your loved ones and your neighbors. Let me check a couple of things here. All right. We'll give folks a chance to come on in. All right. Hey, Janine, you made it from the UK. You're still up. Thank you very much. Good to see you. All right. See who else is coming on in. Hey, Terry, do me a favor. Put it on here for me. I heard. Yes, Terry. My wife Terry is moderating today. Hey, Sandra, from TNT, from Trinidad and Tobago. Wish we were down there. Tell you right now, probably a good place to be. Glad you're doing well, Miss C. Thank you very much. All right. Thank you, Terry. And there we go. We're good now. All right. Hi from Iowa. How we doing out there, Iowa? Everybody's good? Frisco, Texas, just north of Dallas. I've been there many times. North Carolina, welcome, Kathy. All right. So another person from England, Frisco. Y'all keep your heads up down there, Frisco. Motown, good to see you, Beth. All right. And we're going to go ahead and get started. Hey, Florida, good to see you, Rhonda. Maryland, right down the street, my man, Sean. Good to see you. Now, we're going to start. Today's focus will be, anything and everything podiatry. We're going to talk about some of my recent videos. But I want to just open the floor right now, talk about the latest thing that's going on here in America, across the world, and that's, of course, the coronavirus. This platform today is not meant to address that. I'm not an epidemiologist. I'm not an infectious disease specialist. So if you have any questions or comments directly concerning coronavirus, this will not be the platform for that today, but I will direct you to coronavirus.gov and your local authorities for all the information that you will need and you will know. Just let you know we're doing well here in DC. We're an essential service, so our office is still open. The way we're dealing with it in our office is cutting our appointments in half so that we can decrease the number of people that are in the waiting room at any one time. And that way we keep things flowing, we keep the good space between folks in the waiting room, and everybody stays hopefully good and healthy. Hello, China. We have a lot of prayers for you in China and around the world for that matter. All right, but we're going to talk first about latest couple of videos. Now, if you submit a question and I miss it, please submit it again. And if I still don't get a chance to get around to your question, in the replay of this video, which will be up later this afternoon, submit that question in the comment section and I will get back to you. Now, the past couple of videos, this past series I did was on smoking in the feet. Smoking affects more than just the lungs. It's more than just lung cancer. Smoking affects the body, head to toe, skin to bone. And in particular, the effects it has on the feet is that on the vascular system. Now, smoking causes vasoconstriction. That means it makes the blood vessels smaller and tighter, and that makes a decrease in blood flow. For those who are heavy smokers over years, over decades, that can cause a significant decrease in blood flow and give that particular smoker the same symptoms as you would see with somebody with advanced diabetes. That's called Buerger's disease. Buerger'(S) disease. Buerger's disease is an inflammatory condition of the blood vessels as a result of long-term smoking, so that can happen. If you go back to the last two videos of this one patient, started out with the issues he had with his toenails and the severe fungal infection that he had, dealt with that and got that looking better. And then the second video, we worked on his wounds. He had a significant wound on his big toe and a wound on the bottom of his foot. And the wound that we were able to get healed 4 years ago still remains healed, but the callus there is making the skin underneath that wound very thin and subject to re-injury. So we're keeping an eye on that. We are re-evaluating his vascular system this week as he comes in for vascular testing. So for those who sent comments in and had, some pretty bewildering things to say about smoking in the feed, how smoking has nothing to do with the feed, and we're just whack jobs trying to infringe on folks' rights, nothing could be further from the truth. As a physician, it is my job not only to treat what I see in the office, but also to completely educate you on what's going on, the things that you're doing that contribute to the issues that you have or may have, and what you can do to make things better and to stop that. And if smoking is a problem, like in this particular patient or a bunch of other patients, then it is my job, it is my duty, it is my obligation to let that patient know that smoking is the cease so that his condition can get better. All right, so let's open it up to some questions. Again, anything foot and podiatry related. One more time, if you have a question about coronavirus, today is not the platform for that, but there are other platforms that you can go to, particularly your local authorities on that. All right, so we're going to go ahead and start with some questions. Terry, who's moderating, what you got first for me?
Okay, so we got Regina Sharp. She asks, how do you know you have an ingrown toenail?
Okay, thank you very much, Regina, for joining us today and submitting your question. Now, to know if you have an ingrown toenail is to know exactly what an ingrown toenail is. An ingrown toenail differs from what we call an incurvated nail. That is the nail that's curved in toward the skin borders of the toe. It can cause pain. It can be very irritating. But if it hasn't broken the skin, it is not by definition an ingrown nail. It's just an incurvated nail. An ingrown nail is actually a breaking of the skin by the nail edge, which then allows bacteria to get in and set up a bacterial infection, or what we in podiatry call a paronychia. That's an ingrown toenail. So if you have redness, swelling, discomfort, pain, and particularly if you're draining any fluid, whether it be clear or pus or anything like that, that by definition is an ingrown nail. If you don't have the break in the skin, the redness, or the pus draining, but it's still uncomfortable for you, it's maybe an ingrowing nail or an incurvated nail, and that still needs to be evaluated by podiatrist before it becomes a full-blown ingrown toenail and you end up with a whopping infection. Great question. Next, what you got next for me, Terry?
Okay, and so Mike Smith says I got a tingling in my toes and it's hard for me to cut my own nails down. So it's kind of like a question statement.
Well, Mike, thanks for joining us again. Tingling in the toes, you got to find out why that is. Tingling in the toes can be from a number of things. It can be from the position you're sitting or lying in at the time, or it could be something more systemic. It could be diabetes, neuropathy related with that. It could be something going on with the lower back. The nerves that go down to the feet start in the lower back. So if there's an issue with the lower back, either the disc in the lower back, arthritis of the vertebrae of the lower back, or any issue going anywhere between the lower back and the tips of the toes, whether it's the way you sit, whether it's sciatica or anything like that, can contribute to these symptoms. So the number one thing, like I always say, find out the root cause, you can get to the better answer. So if you're concerned about trimming your toenails in this situation, I would definitely hold off on doing that and see a podiatrist and see what's going on and get to the root cause of the issue. Great question.
Okay. I think this Lonnie baby is asking, is there other medicine besides gabapentin?
Gabapentin.
Gabapentin, okay, that helps with neuropathy of the feet.
Okay. There are a number of medications that are help with neuropathy of the feet. Again, knowing what's causing the neuropathy to begin with is important, but there are many medications in the gabapentin class. Lyrica, gabapentin, Tegretol are the medications in the anti-anxiety medications. They tend to be very effective on neuropathy. Also, there are topical medications that you may want to try like Icy Hot, Bengay, Absorbing Junior, Biofreeze, things like that, capsaicin, uh, diclofenac gel, things like that that can help uh, abate the symptoms. Uh, Also, vitamin therapy has been shown to help with the symptoms of neuropathy, particularly the B6 and the B12 group of vitamins. Using those in relatively high doses for a long period of time can help to do that. Now, when you're dealing with neuropathy, remember there's no quick fix. There's no painkiller, if you will, for neuropathy. Neuropathy, when we use medications, be it topical, oral, or a combination, these are things that work over time and work over time in order to decrease symptoms. They're not a painkiller like ibuprofen or like Tylenol or anything like that. Great question.
Okay. So Jordan wants to know if your office is going to be open tomorrow and if you have any shea butter in stock. They want to be there tomorrow.
We will be open tomorrow. Again, we're using our system of decreasing our patient flow, so we keep a minimum number of people in the waiting room at any one time. My combination, my information is in the description of all my videos. Check at 9 o'clock to see when is a good time for you to come by, and we'll go from there.
Shea butter.
Oh, shea butter. We have some shea butter later this week.
Mm-hmm. All right. And okay, so my husband's toenails look like.
Who's this?
Well, they look really bad.
I mean, who's the person asking the question?
This is Tiffany Body.
Tiffany, all right.
She said they look like roach backs, and his toes too. I guess she wants to know what can she do for them, and also, let me see what else is out there, and how can one make an appointment to see you? They're located in the DMV.
Okay.
And so something about toenails, probably ram's horn toenails. How can she treat them at home? And you already mentioned making appointments.
Okay. As far as making appointments, of course, my contact information is in the description of all my videos. It will be in the description of this one. So please get in touch with me through that method. We have various ways that you can get in touch with us, as well as social media. All my social media contacts are at DC Foot Doctor, so you can start there as well. Now, as far as the lady whose husband with the toenails, again, let's figure out what's going on with them. If he's uncomfortable with you trying to take care of them, then urge him to see a podiatrist as soon as possible so it can be determined what's causing them, and the podiatrist will be able to take care of the toenails and trim them and have them looking much better and much more comfortable environment and situation, and the proper tools in which you can use at home.
Okay, so Cheryl Jackson also wants to know. She says she has a growth on the top of her foot at the base of one of her big toes.
Okay.
She says she's been told it's not a bunion. It doesn't hurt, so what could it be?
Well, if it's at the top of the big toe, and if it's hard and firm, and it's right over the joint, it could be a bone spur. All right, bone spurs are a result of chronic arthritic changes of the joint. Over time, as the bones rub together, you get bone rubbing on bone, you get the formation of spurs. So it could be that. I have a video in my series called "What Is This Bump?" Go check that video out, see if it's something similar to what you're experiencing. But that's what that was. That was a removal of a bone spur on the top of a lady's foot. Now, if it's soft and movable, that's something else. That could be a cyst, that could be fat, that could be a nerve growth. It can be any number of things. So if it's soft and movable, that's something different. If it's hard and firm and you can't move it around, more than likely it's a bone spur. But I would definitely get it checked out before it gets to a point where it starts to hurt. Once it gets to the point where it starts to hurt, then your treatment options begin to narrow.
Okay, so Sean Durgan, he's a healthy 37-year-old man, 18 years in the military, and he wants to know, how do I treat how do I treat the cracked calluses under the balls of my feet? Okay.
Number one, let's deal with the cause. I always start with the cause. It's a flat foot, is it a high arch foot? Is it the shoe type? Was it those military issue boots that you worn for a long time? I mean, are you an athlete? Do you participate in a lot of high impact sports, is there a weight issue? Is there a significant weight gain that could be putting pressures on the ball of your foot? Once you figure those issues out, then we can start to narrow. Yeah, shaving down the calluses on a regular basis will be necessary. Dealing with some good moisturization would be very helpful too, whether it be shea butter, a good skin lotion, wearing socks when you wear shoes, avoiding sandals and flip-flops and things of that nature, even as we go through these warm months for a while, doing those things to help decrease that formation. A good callus file, not a sharp one, but like a callus style, more like sandpaper type. You can try that. Now, if you have diabetes, neuropathy, poor circulation, things of that nature, I always urge folks to see a doctor first, see a podiatrist first, and to deal with those. But these are things that you can do at home to start. Thank you for your service, man.
Okay, LB Calkins. She says, "Good afternoon, Dr. Jefferson. How long should one have to take Lamisil by mouth in order to see its results?"
Okay, so when I prescribe oral medications, particularly Lamisil or terbinafine as it's called now because it's generic, I always caution patients or let them know or educate them that what we're treating is the new nail that's coming in. We're not treating the nail that we see today, because the nail that we see today, those changes have already been made and those changes are permanent. Now, nails continue to replace themselves. They're like hair. They're always in a constant state of growth throughout our entire lives. They may get slower as we get older and deal with circulation issues and things like that, but nails are in a constant state of growth. So when we give Lamisil or even a topical or laser or whatever we're treating the new nail that's coming in, keeping it from getting infected. So as the new nails come in, it gets healthy. Now, particularly with Lamisil, the treatment is for 3 months. After that 3-month period, there's enough of the medication in the nail that is continuing to work as the nail continues to grow. As you trim the nails every 2 or 3 months, we look for signs that the medication is being effective and is clearing the nail. Usually after that first 2 or 3 months, we'll start to see some clearing at the base of the nail or where the cuticle of the nail would be. Once we start seeing that, then we feel good that we're on the right track. After about 6 to 9 months is when we determine how effective the medication is and really what our prognosis is going to be. Anything sooner than that is just a guess. But 6 to 9, even 12 months in some folks is when we determine if the treatment using oral medication, and particularly Lamisil in this case, is successful. Great question.
Okay. So Raydon Musgrove, she says, "I've developed blisters under my big toenails from small shoes. There is blood underneath them now. Will I lose both of my toenails? Thank you very much."
Well, to get blood under the nails, which we call a subungual hematoma. Subungual means under the nail. Hematoma basically meaning a blood blister. It depends on how much blood there is under the nails and whether there's been enough blood collected that it loosens the nail, the hard part, from the nail plate, causing the nail to move around and shift, and then you risk the nail coming off or getting pulled off by your socks or bedding and things like that. If it's just a little bit, that little bit of blood will grow out as the nail grows out. But in this case, what you want to do is evaluate all your footwear, all your shoes, and if you have to go to a larger size shoe, deal with that. And particularly if you're a very active person, if you're in fitness, sports, things like that, then those folks tend to have this issue more so. Proper shoe style, proper shoe fit, making sure that the toe box, that's where the toes goes into the shoes, is nice and high to accommodate the toes. If you have deformities such as hammer toes, where the toe is bent like that, and the toe is catching more of the ground as you walk, then those issues may have to be addressed. See a podiatrist, especially if it's continuing, if it's a chronic issue, to get to the bottom of it, see what you got to do before you start developing chronic nail issues, and particularly nail fungus. Loose nails allow fungus and bacteria to get underneath the nail plate to set up a fungal infection. Thank you.
Okay. All right. And so Wendy Close, she says, "I have flat feet, genetics, and I have severe overpronation. Are ordering custom orthotics really worth it? And are there any non-custom brands that work well?"
Okay. Now, we get this question from time to time: custom made or prescription orthotics versus non-prescription, or things that you can get over the counter at the store, at the sporting goods store, or you can order online. Now that can be kind of tricky depending on what your issue is. Now, if you're severely pronating, my question would be: is that something that someone has told you, a professional has told you, or something you figured out on your own, or did you go to one of those kiosks in the store? Things like that depends on where you get your information from. And then to determine whether you need something custom versus something over the counter depends on if your issue is rigid, it means no matter what you do, you're always flat-footed, or if you're flexible, which means that it can be manipulated and controlled, or somewhere in the middle. Now, if you have a particular issue where there's one foot that's more pronated than the other, or one foot has a significant size difference than the other, then you would definitely need something custom, because you're not going to be able to find anything over the counter or online that's going to be to deal with two different issues, or two slightly different modifications, if you will. So that's where custom orthotics are more advantageous, so that can deal with individual issues for each foot.
Okay.
Mhm.
All right. So I'm going back, trying to get some questions here. There are a lot coming in.
Okay.
And let's see.
Let me take Dalia Hernandez.
Okay.
Hey, Dalia. 22, don't wear tight nail shoes, and I've noticed in the past years my right foot seems to be forming a bunion. I was wondering what actions I can take to stop it from protruding more outward. Dalia, thank you for the question. 22 years old, that's very young, and it's good that you're starting to notice these things and pick up these little changes about yourself. Uh, Bunions, to understand why you have it, is to understand where they come from. It's a misconception that it's just shoes that cause bunions. Shoes exacerbate or irritate bunions. They typically don't cause bunions unless a person has been wearing very small, very tight shoes all their lives, including childhood. Now, sometimes bunions can be formed as a result of genetics. You can blame it on your parents or your grandparents. It could be an issue of a difference in the limb length of your legs. It could be being flat-footed. Flat-footed folks tend to develop bunions at a higher incidence than folks who are not flat-footed. So dealing with it is to find out what's causing it, or what you can do in the meanwhile, especially before it starts to get painful, or before it starts to really get irritated. There are toe spacers you can purchase from your local drugstores, or you can order online. It goes between the toes. It's usually made of silicone or something like that. It's reusable, washable, and will help align the toe as you go through your day wearing a closed shoe. There's also bunion straighteners, bunion shields, things like that. You can wear either during the day if it's small enough, or at night if you really want to try to manipulate it and try to change the direction, or change how the soft tissue is reacting to the change in the joint itself. But if it gets to a point where it's really becoming bothersome, it's really noticeable, and it's starting to become uncomfortable or painful, then you need to see your local podiatrist as soon as possible, so you can see what's the best way to go about it, whether it's orthotics or other type of more custom type of devices to straighten the toe out, or all the way to surgery if need be, if it's very uncomfortable. Thank you.
Mhm. Okay, so
Mm-hmm.
Rhonda Donald asks, she says, my toe
Mm-hmm.
next to my big toe is darker than the other toes. Does this mean that I'm going to have diabetes?
Well, I don't know if you're talking about the toe, the skin itself, or the nail itself. I would ask you to resubmit that question if you tell me if it's the nail or the toe or both. Uh, that doesn't necessarily mean that you're going to have diabetes, color changes in the foot. What you want to look at if you're concerned about developing diabetes, number one is family history. You have your parents, your siblings, your grandparents, aunts and uncles. Where is diabetes in the family? What other symptoms are you having? Are you having chronic thirst, chronic urination? Have to go to the bathroom a lot? Are you always hungry? Are you noticing things like numbness, tingling, funny sensations in the toes, feet, fingers, and hands? Are you having visual disturbances? Things of that nature. Have you had blood work with your primary doctor lately, where your blood sugar may have been normal, but high normal, that so-called borderline that people like to use. So these are the issues you need to look at as far as, possible signs and symptoms of diabetes. Remember, most people who are diagnosed with diabetes have actually had the disease years before they were actually diagnosed. So look for these signs and symptoms that I just talked about. Discuss them with your primary doctor. Take a picture, send it to me. Again, my contact information is in the description of all my videos, and we go from there. Thank you.
Okay. All right. So, hey, Abby
Hmm.
says, how do I go about getting specialized shoes for my extremely flat-footed, wide width, large shoe
Okay.
shoe size for my feet? For my teen, who is currently an 18-19 size.
Okay.
She says, I know the right shoes are important.
Okay. Now, for a teenager with a foot that big, yeah, you're not going to be able to go to the local shoe store or the department store or mall and find a shoe that's going to fit him or her. And that's for any instance, whether it be, very large feet or very small and narrow feet in an adult. I've actually seen adults having to wear kid-sized shoes because they have small feet. But in that instance, what you want to do is go to your local podiatrist. That podiatrist can examine, make recommendations, and then write a prescription to a local orthotist or pedorthist or shoe specialist that can make those shoes and insoles for your child so that he or she can be comfortable and be active and all those things like that yourself. Now, check with your insurance carrier to see what they cover when it comes to shoes and insoles. The custom shoes and insoles can be quite expensive, so you want to see what, if any, they do cover, but before you make that big commitment.
Okay.
Mm-hmm.
All right. So we're getting a lot of questions in.
Okay,
So
very good.
C. Ellison asks, why is bunion surgery considered major surgery?
Well, anytime you have to make an incision from the skin through bone and then make a cut in the bone and or remove bone is considered major surgery. Whenever you're going all the way down the bone and removing something, at least in my definition, it's major surgery. One, because of the amount of work that's going to be done. Hardware may be put in, plates, screws, pins, things of that nature. And then what really determines, at least in my eyes, what's major surgery is how long the recovery is going to be. All right, if I'm putting hardware in, if I'm putting a couple of screws in, things like that, the recovery time for that surgery is at least 2 months because that's how long it takes bone to heal.
Mm-hmm.
All right, so again, it depends on the nature of the procedure, the equipment and hardware used, and how long the recovery time is. Recovery time for a simple hammer toe without hardware is 3 to 4 weeks. And then what's minor surgery to me might be major surgery to the patient. So before determining whether bunion surgery, which is an elective procedure, is good for you at that particular time, know how it will affect you, know what your recovery period may be, and then you can determine, how those things affect you, your daily life, your work life, how you interact with your family, things of that nature.
Okay.
Hmm.
So Ross, I hope I pronounced your name correct. Ross.
Hmm.
Like, okay. So she says, or he says, I have noticed lately that in the evenings I get cold feet when I'm in bed.
Hmm.
Then later they get warm again. Am I having vascular issues? And how come do I not feel this during the day?
Okay.
Thank you, Shay.
All right. All right, Shay, great question. Vascular issues of the feet. There are a number of issues that could be causing any change in vascular issues of the feet. Now, throughout the day, we're more active. We're moving. We're standing. We're walking around. Anytime we're more active, that increases the blood flow to the feet. We have the calves pump more, and so they help bring more foot down, more blood down to the feet as we remain active during the day. Even if our jobs are somewhat sedentary, we're in a more what we call the feet are in a dependent position. They're down on the ground. Gravity helps to bring the blood down, so that's why it's not an issue. Now, when you get home and you elevate your feet, or you put them in the bed, or they're parallel to the floor, and you feel them get cold, for a while. That's what we call that's an issue where as soon as you lie down, you have less blood flow. So it could be a situation where your cardiovascular system, at least in the near time when you lie down, is not keeping up with the needs of the feet, and they get cold until you've been in bed for a while, and then they start to be more comfortable. That could be the cardiovascular system catching up and providing the necessary amount of blood to the feet while you're in a recumbent position, or it could be because of your sheets and blankets making it feel warmer. If this is something that's been going on for a long time, where you notice a difference in change of the temperature of your feet when you're lying down versus when you're active, no matter what time of year it is, whether there's snow on the ground or whether it's 90 degrees outside, then that's something that you definitely want to get checked out. Talk to your doctor, talk to your podiatrist about it, and see if you need a vascular workup. Okay.
Okay. All right. And R. Smith, could you please, you said we skipped your question, but I do not see your question. Could you please resubmit your question? And also, someone else wants to know about, is bunion surgery even necessary?
Any elective surgery. Now, elective means it's not an urgent situation or it's not an emergency. There's not going to be loss of life. There's not going to be loss of limb. There's not going to be loss of life function if you don't have it. Now, most elective surgery is because of painful situations, at least when it comes to the foot. Bunions, hammer toes, small cysts, things like that. Now, is it necessary? If it's based on how it affects the patient. If they're having significant issues with pain, discomfort, inflammation, hard to walk, hard to wear shoes, hard to go to work, hard to participate in sports, hard to participate just in daily life, hard to find shoes that fit, then bunion surgery would be something that's that could be very beneficial to that person. Just because you have a bunion doesn't mean you need to have it removed. A lot of people, I see bunions all day, every day. If I did surgery on every bunion that came into my office, I would never deal with nails and toenails or anything else because I'd be doing surgery all day, every day. But just having a bunion doesn't mean you need to have surgery. But if it's bothering you, if it's causing pain, if it's causing difficulty with shoes, then bunion surgery is definitely something that you can consider. Let me see.
Okay, and then someone also asked, since we're still on the subject of bunions, and I'm getting to everyone's questions, but this one is pertaining to bunions. They want to know, what about the bunion correctors, like the things they see advertised on TV? You see a lot of shoes that correct bunions. What about those things?
Now, it depends on how severe your bunion is, whether it's something that you apply to your foot is going to work. If your bunion is flexible, that means you can move the toe and straighten it, then using a corrector device might be more beneficial. The more flexible the big toe is, the more amenable the big toe will be to some type of external device to straighten it out. Excuse me. Need some water, dry throat. All right, sorry about that. So, the stiffer a bunion is, whether it's in the up and down position or whether it's left and right, then the less beneficial an external device will be. All right, so check to see how mobile that big toe joint is. Check to see how much pain or discomfort you may be when you get to the end of the motion of that big toe. The more flexible it is, then something that you would attach to the foot or wrap to the foot to help straighten the toe might be more beneficial for you. But if that big toe is stiff and hard to move, then anything you put on it like that will not work and just be a waste of time and money.
Okay. All right. And Beth Small says, she says, I am a diabetic and I have charcoal foot. I had surgery, but it looks as if the surgery failed. There's a lump on my foot at the bottom and it's causing me to fall. Do you think I should get, and then she stops there, I guess surgery. I'm not sure.
Well,
or what do you think I should do?
All right, thank you very much. For those who aren't familiar with the term Charcot foot, what Charcot foot is develops as a result of severe nerve injury or nerve loss or nerve function to the foot. In the United States and in a lot of the industrialized world, the main cause of it is neuropathy as it's associated with diabetes. So what happens is that the joints and the bone break down, particularly in the middle of the foot, as the person continues to walk on it, uh, day after day, week after week, month after month. Because of the neuropathy, they don't really feel the changes. They don't feel the pain. They don't feel the breaking of bones. They don't feel the breakdown of joints. So as a result, the foot begins to get very flat, and may actually get to a point where it gets a rocker bottom, where the foot is like a rocking chair, like so. That's what we call a Charcot foot. What happens is that the bones on the bottom of the foot begin to protrude, and that can actually cause a breakdown in the skin and cause an ulcer. And in a lot of these patients, or the vast majority of these Charcot patients, there's no pain because of the neuropathy. In the early stages of Charcot, we may notice redness, swelling. So we evaluate these patients. We take x-rays. We take x-rays on a regular basis, maybe every couple of weeks, maybe every month or so, to see if there's any progression of the joint breakdown. Using special shoes, special braces, all the way to significant amounts of surgery may be necessary to correct the condition, or at least to make the foot straighter. Now, if you've had Charcot reconstruction or bone shaved down already, and you're still having problems, then the first person I would go back to is your original surgeon to see what the issue is. Take some new X-rays, make sure you're wearing the right kind of shoes, specialized insoles to deal with that, to make sure you don't end up with breakdown and ulceration. These things can lead to infection, gangrene, and loss of the limb.
Okay.
Mm-hmm.
All right. All right, great. And
Mm-hmm.
so, Random
Mm-hmm.
Musgrove wants
Mm-hmm.
to know, what can I do at home to help with plantar fasciitis pain?
Great question. Plantar fasciitis is one of the number one things
Fasciitis.
that we deal with in podiatry. Plantar fasciitis, for those who are not sure what that means, is a band of tissue in the bottom of the foot. Say that the palm of my hand is the bottom of the foot. It runs from the heel out to the ball of the feet. It's thick, it's fibrous, it's somewhat elastic, and its job is basically like the shock absorber of the foot, so that the bones and the other structures just don't come crashing down to the ground as we walk around. Now, like any fibrous structure, there can be stretch and strain on it, and you can get inflammation, particularly around the heel where it's attached. So, knowing that you have the problem is number one. Number two, there are a number of things that we call home physical therapy that you can do. One of the things I'd like to recommend for patients is what we call contrast bath. Use a heating pad or a warm source, hot towel, something like that, directly to the area for 10, 15 minutes. Then immediately go to your cold source, ice pack, cold pack, bucket of ice water if you can stand it, and do that for 10, 15 minutes and go back and forth for about 3 or 4 cycles. What that does is that the heat opens up the blood vessels, the cold closes the blood vessels, and you get this bellowing type of movement of the vascular system, and it helps to clean out the inflammation. Number two, direct massage, whether you do it yourself or have a loved one in the home do it for you, whether you use their hands or a massage implement, will help to deal with that again, to increase the local blood flow, get rid of the inflammatory process in there. Two, stretching of the plantar fascia. You can do that in a number of ways. There's this device that you can get online where you put your foot in it. It causes your foot to bend like that and stretches the plantar fascia. Standing on your toes, particularly on the edge of a stair, so that you get more action of the calves involved. Stretching that plantar fascia as much as you can. Using a towel or something like that can help stretch, or exercise band around the ball of the foot to stretch that out. There's a number of sites and videos you can go to about dealing with how to deal with plantar fasciitis at home. Home therapy is very important. Even if I'm treating it in the office, I always give my patients some home therapy to do before we have to end up sending them to a physical therapist or even surgery if need be.
Okay. Also, we have several questions about your the foot cream
Mm-hmm.
and Shea Butter,
Mm-hmm.
and just let everyone know if they know of anyone who can help us mass produce it. We're
Okay.
thankful for that.
All right.
And the young lady who's coming to the office tomorrow,
Mm-hmm.
I will have one for her.
Okay.
I'll make it myself.
All right. So we will. What's Jordan was in name, right?
I think so.
Okay, Jordan. We will have Shea Butter tomorrow. I would suggest that you come after 1 o'clock because before 1 o'clock we will be again cutting our office hours down. So we will deal with those who have their appointments first, and we will have some ready for you tomorrow. For those who are uh, want to know how you can purchase it from where you are, we are still looking for help in manufacturing and distribution. So if you know anybody in those lines, it'd be great if you can contact us. Again, my contact information is in the description of all my videos. Thank you very much.
We make it in small batches.
Yeah, we make small batches. It's it's kind of difficult to send out. All of our sales right now are out of the office. Mm-hmm.
All right, and so people are really loving your channel.
Mm-hmm.
And so Cynthia Riddick also wants to know, my toenails are thick and around the part of the toe where the nail grows
Mm-hmm.
out looks dark. Could you give me any advice on this?
All right, so it sounds like you're talking about at the base of the nail, right in here. Where the nail grows or what causes the nail to grow is called the nail matrix. Now, if you're having thickness and darkness of the skin from where the nails grow, it may not be the nails at all. It might be the fit of your shoes. There may be a vascular issue. If your nails look healthy otherwise, that means there doesn't seem to be sign of thickening or any flaking, brittleness, signs of fungal infection or anything like that. It may be other issues. It may be shoes, it may be vascular, it may be sock stockings, things of that nature. If it's been going on for a while, definitely see a podiatrist to deal with that. It could be some type of eczema, or it could be some type of irritation from the chronic friction as you wear shoes and go throughout the day. So again, as I always say, deal with the cause, and then the solution becomes much easier.
Okay.
Mm-hmm.
All right. So we also had Robin Gillespie wants to know. She says, "Hello, doctor. I had an episode of burning feet for a year in my 30s. I'm now 60, and it was extremely painful. I could not sleep or walk. Could you tell me what I should ask my doctor to diagnose the problem?"
Well, if you're still having the problem, burning pain is typically associated with nerve issues, whether it be neuropathy related to some systemic condition like diabetes, whether it be sciatica or some other lower back issue. Then if it's still ongoing, it's easier to figure out. If it's something that you had years ago and the problem was dealt with or went away and you never had that problem, then it's going to be a little harder to figure out. So what I would start with is an examination of your lower back. Make sure there's no issues with the disc or the spine or anything of that nature, or the musculature around the lower back that may have contributed to that issue 30 years ago. Or if you're having lower back symptoms now, stiffness, pain, difficulty moving around, things of that nature, especially in the morning when you get out of bed, then have your doctor do a lower back series. That may be what have contributed to your issue. Most nerve issues that affect the feet don't start in the feet. Most nerve issues start above the foot. And that's because the nerves that end up in the foot start in the lower back. So where there's injury anywhere in that chain, whether it be in the thigh, a nerve in the thigh or in the calf or around the ankle or lower back, you could have symptoms in the feet as a result of that.
Okay.
Mm-hmm.
All right, great. So we got people here from South Africa. We have people here from Michigan,
Mm-hmm.
from all over, and even right here in Maryland. So that's great. So Jordan wants to know, my mom wants to know if I'm not sure if I'm pronouncing this right, but
Spell it for me.
Amope electric foot files.
Amope, yeah.
Amope? Okay.
Mm-hmm.
Amope electric foot files are good for the feet. This is your patient Jordan, the one who can spell
Syndactyly?
Yeah.
Okay. Hey, Jordan. Thanks for joining us today. The Amope device is good if you don't have other issues, if you don't have diabetes, poor circulation, neuropathy, if you're able to use the device safely, keep it clean, and use it correctly. If you have these other issues, I always tell folks to check with the doctor first before using these things, or before letting someone else use it on you.
Mhm.
All right, I've had issues where family members have gone in to help an elderly patient, or help a family member who's elderly, and accidentally injured them, and they may not even known they had injured them. If grandma's on blood thinners and didn't tell you she's on blood thinners, you make a little nick, and next thing you know, it takes an hour or two to stop the bleeding. So you have to make sure that you know what's going on with yourself or whatever you're trying to help. If you're going to use a device like that or any device on your foot, to make sure that you're healthy enough to deal with it. And if you do get the machine, then you can use that safely. But if you have a question, check it with your doctor. Your doctor will be more than happy to answer that question for you.
Okay, great.
Mm-hmm.
So Delilah Hernandez, she says, I'm 22 years old and I
Mm-hmm.
don't wear tight, shoes.
I'm sorry, we answered her question.
Oh, about the bunions?
Yep.
Oh, yeah, you sure did.
Mm-hmm.
And, okay, and so great. And, da, 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 da.
See what we got. I saw
Happy
somebody.
people from
Somebody asked me about
Wisconsin.
my telemedicine link. I think that was LB.
Yes, we want more about that.
Okay, so
Oh, and Lord
as
Wells.
as you know, telemedicine, it's been around for decades. It's no longer something that's used in rural parts of the country or far out parts of the world. Telemedicine is becoming more and more used here in the United States and around the world, even locally. I've been using telemedicine in my office for the past several months. It's great for reviewing labs, x-rays, or anything that you need to discuss with the doctor where the doctor doesn't literally have to put his or her hands on you to help deal with the issue. So what it is, it's a live video conference. It's in real time, and it requires a device with a working video camera and a microphone so that everything can be transmitted between the patient and the doctor. So I've been using it for a while. I'm going to be posting a short video about my telemedicine service on tomorrow. As you know, because of what's been going on with the coronavirus, more and more doctors are getting into it. Understand that it may or may not be covered by health insurance if you have it, so you may need to be prepared to pay out of pocket before that consultation can be rendered for you. But telemedicine is definitely available. It's something I've been doing for a while. It's a great way for me to stay in contact with my patients, not just in this time. But again, I've been doing it for some time, even before this whole coronavirus thing blew up. And I know of other doctors, colleagues of mine that have been doing it for some time. So ask your doctor if they have that as an availability. And if they do, it's something that may be very beneficial to you and your family.
Okay. All
Mm-hmm.
right, great. So,
Carolyn Holmes, Fort Worth. What's up, Fort Worth? I used to live in Dallas, Fort Worth.
Perfect
Mm-hmm.
C Curves says, she says, hi, Dr. Fantastic.
I'll take that.
You like to say fantastic.
Mm-hmm.
I would like to know if it's harmful to sculpt an acrylic nail to an aesthetically to aesthetically please a client who has had a toenail chemically removed due to ingrown toenails.
Okay, so great question. I'm always enthralled by the work that cosmetologists who deal with nails do. Their work is fantastic. They augment what we in podiatry do. And I'm glad you asked the question. And I'm glad you're one that is concerned about your client's foot health issues before you render any type of service. Commend you for that. Pittsburgh, what's happening? Um, it depends on how long ago your client had the procedure done. And if the patient, if it was done last week, then having the acrylic put on it right now is going to be too soon. I would make sure that one, your client's not having any more signs, symptoms, not any more pain, is not having any irritation. The skin looks normal. There's no redness, no drainage, or anything like that. And and again, if you're really not sure, have that person go back to her doctor. Have the doctor write a little note, if just for your own well-being, saying that it's okay to provide these services. Your client will definitely appreciate that you did that, and that you're looking out for her well-being, as well as making sure that her toes look great. Great question.
Okay. All right, great. So Tawina Thorpe says, my big toenail came off due to injury. The whole nail is gone. Do I need to keep it covered, or what do I do until it grows back?
Okay. So keeping it covered depends on how long ago it happened. If it happened a few days ago, then yeah, you want to keep it covered to prevent infection of the nail bed. If it's something that happened weeks or months ago, you don't need to keep it covered if you're not having any discomfort. If the skin is okay, everything will be fine. If you want to, as the nail is continuing to grow out, you can keep a band-aid on it as you go through your day and wear shoes so you can prevent shoe irritation. There are toe caps that you can purchase that are reusable and washable, so you don't have to go through a whole box of band-aids every 2 weeks. And that'll help to keep the nail bed uh, irritation free as you go through your day as the nail grows out. Now, in a healthy adult, for a big toenail to replace itself, it can take anywhere from 3 to 6 months. So be patient with it. If you're still having problems, then you definitely need to go see a podiatrist about it to see what's going on with that.
Okay, great, great. And also, Marina Tyson says, she
Mm-hmm.
says, I have observed a pro, uh, pronate's foot that no longer will fit in her shoes.
Mm-hmm.
Okay, I do not have charcoal foot.
Mm-hmm.
Will exercise help?
Well, if you have a pronated foot or any foot type that prevents you from wearing shoes or prevents you from wearing shoes comfortably, uh, exercise by itself won't change the issue because it's a structural problem. Now, I never say don't exercise unless the person has been recently injured. So definitely exercise, continue that up. You got to keep that cardio and all the other stuff going. But if you're having issues with a structural issue of the foot, be it pronation, supination, flat foot, high arch foot, whatever it may be, then seek help from a podiatrist to see what can happen or what can be done to help you with your issue. If your pronated foot is flexible, then using an orthotic, whether it be custom or something over the counter, will be very beneficial for you to help control that pronation so that you can wear shoes comfortably and go throughout your day and be very active. If it's a rigid pronation, that's a different issue. You may need something to be added to the outside of your shoes to help with that balance and to help with that shock absorption, and again to help even out the distribution of weight from left to right. And so again, so you can go through your day, be comfortable, be productive. Again, check with your podiatrist on that.
Okay, great. Okay.
Joe Q, what's up?
All right. Miss C says,
Mm-hmm.
Doctor, I had a double bunionectomy
Mm-hmm.
in 2016 due to a foot spasms that I was experiencing due to using less than 40% of my joints.
Mm-hmm.
Due to hardware in my foot doctor, um, uh, my foot doctor at the time said, "Oh, I think she ran out of time, but I'm not sure what her question was or
Mm-hmm.
ran out of space."
Was that Miss C?
Miss C.
I think
She
I
says,
think I had the continuation. I
"Oh,
wouldn't be
okay,
able to run again
right
due to the hardware.
there she is."
If I'm feeling good, I can attempt. Can you attempt to run again? Um,
Mm.
a difficult situation when dealing when doing foot surgery on very active athletic folks. I tend not to operate on folks that are very high active or elite type of athletes, especially if they have a schedule of events to keep. So, especially, but you're having double bunionectomy surgery with hardware. Uh, so I'm assuming that's both feet. That's a long recovery. That can be somewhat of a challenging recovery. I don't know if you had physical therapy after your procedures, sometime after your procedures. But if you haven't, that's something I would definitely recommend that you go back to your doctor and request physical therapy to get that range of motion back in the toe. Let that doctor know what your activity goals are. You want to get back to running. Whenever we do surgery to correct an issue like that, our goal is to return the patient to the level of activity they were before the surgery started. So if it's been some time and you haven't reached that goal, haven't reached that point yet, then there is an issue. If you're having problems running right now, I wouldn't try to go out there on your own without getting an evaluation from your surgeon. Get some new x-rays, see what's going on, see if there's a problem with the bone. There may be a problem with the hardware. The hardware may need to be removed or replaced. So again, check with the surgeon, let that doctor know what your goals are as far as your activity, so you can get back to that level and then continue to go up from there.
Okay, great. We got people here from Wales, from
Wales.
Scotland, and all over. And G Smalls just want to say, really enjoy watching your videos, brother. I wish you great success.
Thank you, G.
Endeavors, and stay safe.
Momo from Georgia, what's happening?
All right.
Hopefully, if this thing blows over, we're going to be down in Atlanta for the National Medical Association National Convention in August, first week of August. So hopefully this thing will blow over so that we can get on a plane and get going.
Okay, so great. And Diane Thomas wants to know, is there any help for nerve damage in the feet?
Again, depends on what caused the nerve damage in the feet and then what your symptoms are, what's going on, what are you experiencing day in and day out. Is there a cure for nerve damage? Right now, there isn't. Nerves don't repair themselves like skin and bone and muscle. They tend to not do well at all, even if we line them up. So it's difficult to regain nerve function after injury or after systemic condition. Again, knowing the cause of the nerve issue will help better tailor the treatment that you would need to deal with it. You know, what are your symptoms? What are you having? Is it burning? Is it itching? Is it numbness? Is it tingling? Is it complete loss of sensation altogether? So seeing a podiatrist who will work with your primary doctor and a neurologist coming together will help deal with these issues, whether it be shoes, orthotics, medication, vitamin therapy, things of that nature to help deal with the issues, with the symptoms that you're having, and then work up to see if there's some other issue that could be developing or the problem outside of the feet. Again, like I said earlier, a lot of the nerve issues that we see in the feet are issues above the feet.
Okay, cool. And here's Sleeping Beauty wants to know, she says, my feet have been on fire for years and they tested me for diabetes. They are extremely sensitive and cold. And should I ask for, what should I ask for as far as a test? She says, I'm in Australia.
Australia. Sounds like you're dealing with nerve issues as well. So there's a number of tests that that can be done to determine what's going on with the burning. Again, burning most of the time means a nerve issue. So if you've been tested for diabetes and that's been ruled out, then you need to start with the nervous system from the lower back all the way down, whether it be what we call nerve conduction velocity studies, electromyograms. What I do a lot in my office for nerve issues is what's called epidermal nerve fiber biopsy, where we take a small piece of skin above the ankle, send it to the lab. They evaluate the number of nerves in that small sample and how healthy those nerves are, and that gives us the determination of the health of the small fibers in the skin that go down to the feet, and help us determine what's a better pathway to help this person. If it's a large fiber issue, nerve entrapment, disc issues on the lower back. These are the things that need to be determined. Is it large fiber? Is it small fiber? What works on a short period of time, works over time for you. So again, seeing your doctor to start with a lower back series, maybe some nerve conduction tests to see where the issue with the nerves are located. Great question.
Okay.
my side.
Okay, yeah, we have a lot of questions. It is now 4 o'clock. Do you want to continue?
We can go a few more minutes.
Okay, all right, great. So I'm sorry if I'm not going in order. I think a lot of the questions were already answered through this live, and I see a lot of people are still re-asking a lot of questions. But Ellie B, she also wants to know, do you accept TRICARE Prime? If so, I can ask my PCP for referral to do a telemedicine appointment. Thank you for the great information.
Okay, we do accept TRICARE. That would be great. We see a lot of military and retired military in the DC area, of course. Again, my contact information is in the description of all my videos and will be in the description of this one when it's posted. Thank you for the question. I look forward to being able to help you out.
All right.
What did I just see from Momo? It disappeared from my screen.
Okay, Momo, it's a lot. I kind of scrolled down to the bottom. I think after Sleeping Beauty, I got kind of lost. Okay. Okay, so Be Kind asks if you can you provide any advice on how to find a good foot doctor? That's a great question.
Word of mouth is always the best form of advertising for anything, whether it be podiatrist or whoever does your hair or whoever fixes car engine. Word of mouth is the best. So ask around. If you're in your doctor's office, you're in your primary physician's office, and there's other people sitting in the waiting room, hey, does anybody know a good podiatrist that they could recommend? Of course, ask your doctor. Which podiatrist does he or she refer to? Of course, you always have your online ways of seeing reviews and things like that, and you can go from there. Reviews are kind of hit or miss online because you don't know the person. You don't know really can't really grasp what their experience has been. Just know that every doctor approaches things differently. The way I do things is not the way the doctor up the street or down the street is going to do things. So we've all have basic levels of training that are the same, but people develop their own methods of dealing with things over the years, based on what their likes are, based on what they see in their office, what type of patients they see on a regular basis. So that's what you want to do. Ask around, let your fingers do the walking through your computer. Ask your physicians, and then go from there.
Okay. Another question is, so she says, why do podiatrists refuse to perform a lot of vanity procedures, like removing things that are not painful, but we just don't like them there?
Okay. I was trained, and I agree not to do what we call cosmetic surgery of the foot. Sometimes folks will want us to do surgery on the toe so they can better fit a type of shoe. That's cosmetic. If they have a bunion, whether it be, especially if it's a mild bunion and it's not painful, they're not having issues, then I offer them what we call conservative methods to deal with it, non-surgical methods, because what you end up doing when you do cosmetic surgery of the foot, you take a non-painful situation and turn it into a painful situation. So that may be a bad experience for the patient, even if they have this particular long-term goal. So I've been doing this work for over 20 years. I have never done cosmetic surgery of the foot. There are doctors who do. I'm not saying it's wrong if they do. If they have a patient who wants to have something like that and they understand the risk and the complications and they're still willing to go forward with that, then God bless them. But cosmetic surgery of the foot is something that I don't do. Whether it be a short toe because of breaking metatarsia, if they're not having problems with it, then I won't do it. Again, there's other ways to deal with issues non-surgically like that. But again, look around. If it's something that you want to do, understand what you're getting yourself into, whether it be cosmetic or whether it be elective or whether it be an emergency type of situation. Always understand risk and complications and what you can expect from a surgery.
Okay, so great question and great answer. So, and Krista Locke also says, have you ever considered pedicure services as part of your office. Someone like the meticulous manicurist who is highly professional and seems to have a great understanding with nail
Okay.
related problems.
Okay.
Would
The meticulous manicurist is an American hero. All right. Watch her. Um, she does fantastic work. If you haven't checked her out, check out her channel. She does great work in dealing with all type of nail issues. I come from the medical standpoint from dealing with nail issues and corns and calluses and things of that nature. That's where I begin. But we've added recently cosmetic type of procedural things, what we call foot rejuvenation, particularly for folks who don't have a particular nail problem. They don't have severe fungal infections and things like that, but they want to have certain types of issues in dealing with recurrent issues with cracked heels and things like that. So there's additional things that we provide besides just shaving down the corns and calluses, as far as exfoliation, different types of cream treatment, massage, things like that that aren't particularly covered by health insurance. So that is something that we are getting into, and that we are doing. My wife is a patient; she loves it. Uh, so again, ask around if there are podiatrists that are doing that. More and more are getting into that type of work. Some call it boutique podiatry. Some people call it medicures, not pedicures, but medicures. So see if there are those that are doing that type of work. But again, check again, right, Jordan? Check out the meticulous manicurist. She's doing great work. A lot of times people come to my office with crazy conditions. If you watch the channel, you know what I'm talking about. On that particular visit, you're not going to make them look like they're ready for a magazine cover. That's not the goal when we're dealing with a lot of the issues that I see. But if you want those type of things, if you don't have those type of issues, those are services that we provide. Most of those services are not covered by insurance, so those patients are willing to pay out of pocket for those type of things. But again, look around, ask around.
And then you can do a lot of things that the manicures cannot do.
Right.
So, okay. All right. And I think there were a lot of questions on that. Let's see. And also, Helen Payne says, Hi, Doc. Hi, doctor. My second toe on both feet are pincer and grow inward. I've been gently cleaning them to release the pincer, but how can I encourage them to grow flat?
Okay. Pinch your nails for those
from UK.
From the UK. Welcome. I hope you guys are doing well out there. Pinch your nails. Understand what a pinch your nail is, everyone. Typically, our nails grow with a slight curve, like this. Let's say this is the bone underneath. These two fingers are the bone, and this finger on top is the nail, and the nail's on top, right above the bone. There's only one or two cell layers of skin between the nail plate and the underlying bone. Now, if the bone underneath is beginning to protrude, see what's happening here? All right, because of the pinch your nail, causes the nail to go upward. We call that tent poling, where the underlying bone works like a tent pole, pushing the nail upward, and then the nail grows curved and even grows super curved under what we call a pinch your nail. And by definition, by its name, it really pinches. It can be terribly painful and uncomfortable for a patient. So if it's something that's ongoing, you've dealt with it, you've shaved it, you filed it, you trim it down on a regular basis, you've gone to a podiatrist, then what you may have to consider is having the bone underneath that nail filed down to prevent its protrusion upward to push the nail up.
All right, great. And I just want to mention a comment that Sleeping Beauty says. She says they're in an Aboriginal community, and they don't get feet doctors coming in often. They would love to fly to America. And I'm just thinking we would love to fly to Australia.
Yeah, anybody right now would be love to fly anywhere.
Right, get us out of here. Okay, well, we're having fun. All
right. Hey, Jordan, I see you in PG, right across the street. So again, contact information is in all my videos. Follow me on social media at DC Foot Doctor, DCFOOTDOCTOR. You'll catch me on Facebook, Instagram, Twitter. Did I miss anything? No, I think that's it.
Right. And so how can people make an appointment again to do a telemedicine?
Again, the information for my telemedicine program, there will be a video posted tomorrow. If you're interested in that service for yourself or for a loved one, it'll go through the process of how it's done and how the process is to connect. So look for that video tomorrow.
Okay, continued PayPal for donations to homeless clinic and Ms. Jefferson. Oh, okay. Thank you for answering my question from Raleigh. A lot of people are saying thank you. They're amazed how people feeds are coming out, and the before and after pictures are awesome. They loving the Shea Butter. People are seeing results. Thank you for that.
Fantastic.
A lot of people from Australia are watching in, and this community is actually supporting each other. And Sandra Charles is from Trinidad and Tobago. So I think that covers any question.
Okay.
We have Angela Britton from Frederick, Maryland, that is tuning in.
Frederick, all right, down the street.
I'm looking back through to make sure I got everyone's questions. If I did not, Dr. Jefferson will answer your questions in the chat below. So I'm sorry if I didn't see it. There was a lot of questions coming in. But thank you guys for watching. Does anyone have any other questions? I think we're going to go ahead and wrap up. Doctor, what do you think?
I think so. Again, if we missed your question, or if you had further questions based on the answers I've already given, in the comment section of this posting of this video, which will go up in a little bit from today, submit your question in the comment section of the video from this live feed. That's basically what I'm trying to say. And I'll be able to answer that question directly. Again, my contact information is in the description of all my videos, previous, this, and forward. So if you have anything else you would have a question about, you can email me through there. Again, you can contact me through social media at DC Foot Doctor. And I feel good for, it'd be great to hear from you and continue to broaden this community. Again, I'm going to, yeah, I guess, what do you have? Are there new questions?
Just two more. I see Veronica Everett. She just want to know about the foot pills. I know you see a lot of that on YouTube and on the internet, and people are selling these products. So she says, what's your take on foot pills for dry skin removal on the feet? You can buy over the counter, or are you a fan of them, or what do you think?
All right, foot peel, chemical peels, any type of peel. Check with your doctor, particularly if you have certain conditions, diabetes, advanced age, poor circulation, neuropathy, you're having symptoms of numbness, tingling, funny sensations before so. Be careful with things like that. I had a patient years ago who tried to make a homemade DIY chemical peel using crushed aspirin and water, trying to make a peel, and she burned her foot crazy. Look at my previous video from last year called Ionic Foot Burn. It tells you about these type of things that people use to try to cleanse themselves. So, dealing with things over the counter, if you're unsure, if you have certain underlying conditions and you feel it may be safe or unsafe, check with your doctor. I don't have a problem with it if the person is healthy, has no problems, and uses the product to the letter of the directions. Don't try to do your own thing with these things.
Okay. So, and then one more, I think it was two. I think it was going on when everything else is going on. So there's one about, Lily has one about a plantar wart. Then there's another one about had warts removed. Another one about a wart, second treatment. Okay. And then another one wants to know about a Lyme disease, and I'm going through random nerve pain now on my feet. Is there anything I can do to help with it? And that's Lancome McClinney. I want to also give shout outs to this person. I missed 15 minutes. Okay.
All right.
There's a lot. Yeah.
Okay. Let's see. Lyme disease. Now you're having nerve symptoms in your feet. That's a residual chronic neuropathy that you're having. All right. So if there's not a particular uh, nerve pathway that can be uh, identified, if it's not a say sciatic nerve problem, or you can't narrow it down to which what we call a dermatome. A dermatome is an area of skin that's controlled by a nerve or a couple of nerves. If the issue cannot be narrowed down to a particular dermatome, then you definitely need to see a podiatrist and a neurologist to see what's going on with this nerve issue. Yes, Lyme disease, the infectious process can be dealt with, but some of the residual effects can last for years, particularly like in this case for you, the nerve issues. See a podiatrist, see a neurologist, narrow down which nerves or which dermatome in particular are affected so that the right treatment plan can be developed for you. You just don't want to throw something against the wall and see if it sticks with this, because as you know already, it can be very uncomfortable, very aggravating, very frustrating trying to figure out things that are going to work to deal with this question. See these doctors, narrow down the location, and get it squared away.
Okay.
Mhm.
And I think it's Lily, Southern Grape Lady, wants to know how to get rid of plantar warts.
Plantar warts are caused by a virus, particularly they're caused by several
White one.
strains of the human papilloma virus. All right, now, other strains of human papilloma virus cause cervical cancer in women. Uh, Same family, different viruses. Don't think you're going to get cancer from getting a plantar wart, but it is a human papilloma virus, so you have to deal with the virus itself. Plantar warts take a long time to treat. They have their skin manifestations, these callus-looking growths that we call verruca, that is little black dots in them. Those are capillaries that easily bleed when we treat them and shave them down. A number of ways to deal with them. Of course, cryotherapy, the freezing, the chemical wart removers, whether it be liquid or patches or what have you. Sometimes other medications, oral medications are used, like cimetidine, things like that, that are used for stomach upset. There have been some studies that show that long-term use of those can help with plantar warts, especially if there's a lot of them on the foot. You know, you can't freeze 20 lesions on the foot. It'd be incredibly painful for the person. So the number of lesions that are there determine the treatment. How long the issue has been there determine the treatment. How painful and how uncomfortable the lesions are determine the treatment. So if you've seen a doctor already, continue that treatment to plantar warts. Take a long time. There's no time calendar to tell you when it will go away. I've treated patients once or twice and it went away. I've treated patients over months where it took to go away, whether it be a solitary lesion or multiple lesions. You got to be patient. You got to be diligent. You got to be willing to change the game plan if nothing is working for you. All right. All right. Thanks again, everybody, for all your questions, your comments. Again, if I didn't get to a question, please leave it in the comment section of this video. Reach out to me on social media at DC Foot Doctor. We will be doing this again soon. Again, with these uncertain times, protect yourself, protect your loved ones, and follow the guidance of your local authorities. And most of all, like I always say, take care of your feet. Peace. All right.
We tried to answer a lot of questions. You